Hey guys.
Okay, logging in. Hold on.
So you guys, I plan on we'll do the test first thing once everyone gets in here. We'll have to connect to Land School Air and all that like we normally do. And then when we're done, we have, just a little bit of time that I want to do some content stuff with you. So I have some stuff about HIV and AIDS I was just going to talk about with you. And then I made like a little Kahoot that we could do afterwards too. So we could do that. And then later on in the day, once I come back from my appointment, we'll get together and do some lab stuff. I apologize that it turned out this way this week with that being at 12:30. I wish I could have had it at a different time.
Professor Silk,
Yeah.
I just wanted to let you know that regarding our email today, um, I'll send that right after the test. Is that okay?
Yeah, that's fine.
Okay. Because I was trying to do it right now, but it won't let me log on to the Outlook thing because it says my account like expired or something. But I'll just send it from my email, my like regular email to yours.
Okay, that's fine. I'm good with that.
Wait, what are we supposed to email?
Now she has something specifically to email me.
Oh, okay.
So that's all. We're good. Okay, so if you guys can start sharing your webcam with me, so we have that done, and then we'll go ahead and start getting into Land School Air because that always takes sticking forever, it seems like. Let's see where I'm at here with that.
We're allowed to use a blank sheet of paper and stuff, right?
Yeah, I'm all right with that. Okay, let's see here. I have so many things on this page, it's not even funny. All right, here comes the link here for you. You guys understand how to get into the exam, right? So it's not like our other classes where we had, that quiz thing on the side where you click on that. It's actually in Realize It. So you have to get into Realize It to get to it.
Will you repeat that again? Sorry.
You have to get into Realize It to get to your exam. So it's not like our other ones that we've done in the past where, you click on the one thing on the side and get in there. It's not like that. All right, I've got 2 people in so far. I see Krishna and Aman. Now I see
So
Priya. I see
when you
Ina.
say we need realize it, is there a specific one or just any content we enter through that or what?
Here, let me see if I can get in there and figure it out for you. This is just weird. I get it.
I just clicked it. It just basically loads into like a new window and then it just says begin assessment.
Okay,
Wait, on any
so
of the contents?
You go to the modules and it says like exam 2, like exam 1. You just have to find it in the modules and it will take you directly where you need to go.
Yes, it's probably under module 4, right?
Yeah, it was. You just click on the link and it takes you directly to the exam.
Perfect. All right, I've got Vera in now, so we got 4 of you. So who the heck are we missing? We're missing 2 people. So Stella and who else?
Did you already click the do assessments or you wait first? Aman?
I didn't click anything yet. I'm just waiting.
Okay.
Yeah, I have a code to give you. So do you guys need to text any of your classmates to see where they're at? I don't know where these other 2 are.
Can you see mine?
Not yet. There we go. Now I see Lisa and I see Tanisha. So I've got 6 of you in here now. So everyone that's in here is in. All right, here comes the other code to get in. I'm going to mute myself so you don't have to hear me.
Miss Silk, I just tested them. They said they are coming. She said she thought it was 9:30. Cynthia.
We can go ahead and put the code in and start, right?
everyone's done now. So let's clear here. So for those of you, I don't know if you saw some of the stuff I was saying in the chat here, but there's one question on that test that I think it was a math question. You were supposed to have a picture of something and it wasn't there. So that's a problem. So you'll all get, you know, points for that one at least. I will go through these tests later on this evening to make sure there's no other issues that I see like that, because obviously, you know, if you get points, you need points. So I will look and make sure there's nothing else. So I know this whole platform of Realize It is new for you. I get it. And I know it's not perfect. So if you didn't get as high as you thought you should, you know, we'll see if we can improve it for next time. So yes, you still have to remediate if you didn't get a decent enough score. So we'll work on that this coming week. Okay. All right, so I don't want to spend too much time with you guys now because we already spent, you know, all this time in the test, but I have a, this is a PowerPoint that I did about HIV and AIDS that I share with my other class that I do. So it's not the same one as from your book that I just posted on your page. It's not that, but I'm going to go through this real quick with you. And we'll see, you know, if that helps you kind of have a better understanding of that stuff, hopefully. Okay, so in this HIV/AIDS topic, of course we know that HIV stands for human immunodeficiency virus. So what happens is when you get a virus like this, it infects your body. Once it gets into your cells, it kind of attacks your immune system. So normally in our body, we have these CD4 cells or T cells that kind of help attack bad things in our body to keep us healthy. But what happens with this is HIV comes in and attacks those good cells. So you don't have as many of those CD4 cells anymore. And so anytime there's some kind of bacteria or something that you could get into your system, you could get it at the drop of a hat now because your immune system is really low now. So it's kind of a novel type of a virus. It's kind of scary that, you know, you have that happening. All right, so how is it transmitted? So most of the time people will get it, you know, through body fluids. So typically it's going to be anal sex, vaginal sex, or oral sex. And then also you would have to have like contact between broken skin. So like say I had, you know, heaven forbid, but in my mouth, like I had some kind of opening in there, you could get it that way. Contact between broken skin, wounds, and mucous membranes and HIV-infected blood or body fluids would give you this. Years ago, when people used to get blood transfusions, there would be a risk for this from that. But now they have all of these safeguards in place to where, you know, when you have to give someone a unit of blood, they check it every which way under the sun to make sure that it doesn't have anything like that going on. So your chances are really, really slim for getting it that way anymore. Also, like when people used to get organ and tissue transplants, that was a problem back then as well, but now not so much. Another one that some people don't really think about is you can pass HIV from mother to child during pregnancy, birth, or breastfeeding. So like if you know the mother has HIV before she gives birth, just the baby coming down the birth canal can get into contact with those fluids, and it can have, you know, HIV because of that. So that's a concern. And then also being stuck with an HIV contaminated needle or a sharp object, of course, that would be a concern as well. So those would be your main ways to get it. So who is most at risk for this? Gay and bisexual men have the largest number of new diagnoses in the United States. So that's a big concern for that group. Blacks and African Americans and Hispanics or Latinos are another group that can get it as well. Also, transgender women who have sex with men are among the group of highest, infection rates as well. When people are IV drug users, that's a big risk too. So really, there's no really effective cure that exists. Now, of course, researchers, ever since this came about, this disease came about in the early 80s. Ever since this came about, people have been trying to figure out a way to help with this and to try and find a cure. But, we're not quite there yet. So we definitely are better than we were years ago, for sure, though. So what they do when you get this is you just try to control the disease process so you can prolong your life for a little bit longer. So what they do is they give you medicine called antiretroviral therapy. So another name for this is ART. So if you take it right away and you take it, like you're supposed to every day, this medicine can make you have a better quality of life. So it can keep you healthier, and it can decrease your risk of infecting others, and it can, prolong your life. So before the introduction of this medicine back in the 90s, people with HIV could progress to AIDS in just a few years. So we really have come a long way with this medication. So today, someone diagnosed with HIV and treated before the disease is advanced can live nearly as long as someone who does not have HIV. So that's great, Before I go to the next slide, I just want to say, I want to talk about, like, if you were working and you accidentally got stuck with a needle, like, what would you do? So have you guys ever been like that at work? Like, did you ever see someone accidentally get stuck with a needle or something, and then they had to go through this whole rigmarole for what to do in case they got HIV? Did you guys ever have to deal with that? No one wants to talk. Do you guys know what you're supposed to do if you accidentally get stuck with a needle? What's the stuff that you're supposed to do?
So aren't you supposed to like notify someone right away and then try and go get tested for it? Because don't you have to get tested for it?
Yes. Yes. So if you accidentally get stuck, they want you to notify your supervisor, and then they want you to go down to either, so it depends on where you work, but like at SUMA, where I used to work, they had employee health. So you would go down to there and they would kind of do everything you needed to have done there. Some places don't have an employee health, so you would go to the ER and you would, get taken care of down there. So one of the things they say, if you're bleeding or something like that after the stick, you want to, rinse it off under some water, wash your hands really well, and then, you want to tell your supervisor, because you need to do kind of an investigation into the person who, may, like, if you had a patient's blood on this needle, you need to do that investigation into them to see if maybe they had HIV or not. And you have to tell them, so someone has to tell the patient, oh, this person got accidentally stuck, do we have your permission to do this HIV test? And then they have to go through it like that. So when you go downstairs to ER or to the employee health, they will ask you 3 million questions, of course, and then they actually will do some testing on you, and then they have to start you on this antiretroviral therapy, just like someone with AIDS has to do. So you will get a prescription for this, and you'll have to take this medicine for a certain amount of time until you're in the clear. So it's very stressful for people when something like this happens, because, you just don't know for a certain period of time if you have it or not. I was reading though that, out of everyone who ever gets stuck accidentally, it's like something like a 0.23% chance. So it's very small. It's not like a huge, chance that you would get it. But still, at the same time, it's very nerve wracking for the person. Okay. So I just wanted to say that because I don't know if you guys knew, what you're supposed to do with that. So, all right. So with symptoms, this disease is kind of interesting because you can walk around and feel not really that bad and still have this and not realize that you have it. So, like, I don't know if you guys remember back when Charlie Sheen came out and said that he had this. So he was infecting people for a long time before he realized he had this. So when you get it at first, you may not have hardly any symptoms at all. And then when you do start to have symptoms, it might just be like flu-like symptoms. So, chills, fever, muscle aches, nothing too bad. So you may just think that you have the flu or something. You may not think that it's anything. So you can still be going around and infecting people, during that time. And then by the time you really realize that you have it, then you have other things going on. So about 40 to 90% of people have these, just real slight little symptoms, these flu-like symptoms, within 2 to 4 weeks after they got exposed to HIV. So other people don't feel sick at all during this stage. So sometimes people don't have any symptoms. So this is an acute HIV infection when you have stuff like this going on in this list. So nothing too worrisome, to people. Although the night sweats, I would think, would be a little bit more worrisome to someone, but maybe they don't think that at the time. Okay, so these symptoms can last anywhere from a few days to several weeks for people. And during this time, the HIV infection may not show up on some tests. So even though the person is positive, if they took a test, it may say that they're negative. But people who have it are highly infectious and can spread it to others. So that's the scary thing about this disease. Some people who have HIV don't show any symptoms at all for 10 years or more. So it's kind of scary. All right. I don't know if you guys are taking notes or not, but if you wanted to, you can write some of this stuff down here. So as far as stages go, so when someone is sick with HIV, there's 3 main stages that you kind of go through with this. So stage 1 is where, you have HIV, you have this CD4 count, which remember our CD4 cells are the cells that attack bad things in our body. So our CD4 count starts to go down. So it might be 500 cells or more. And so at this point, we would have HIV, but we're not super sick yet. In stage 2, now we're a little bit sicker. So our CD4 count goes down even lower. So now it might be anywhere from 200 to 499 cells. And then when you talk stage 3, this is when you go from HIV to AIDS. So now your CD4 count is 200 or less, and you have some kind of defining condition. Like, so typically when they say someone goes from HIV to AIDS, they have some kind of opportunistic infection that starts to attack their body. So whether it's, that crazy pneumonia that people get, or some type of cancer like Kaposi sarcoma, or some kind of fungal infection, whatever. There's 3 million different things that you could get. But opportunistic infections are things that you or I would be able to fight off with no problem because we have a good immune system. But at this point in this person's illness with their HIV, their CD4 count has really gone down quite a bit. So if you're less than 200 cells, you don't have much to fight that off anymore. And so it's going to be really hard for you to stay healthy. So you get sick at the drop of a hat. So that's stage 3. So now I'm full-blown AIDS, I have an opportunistic infection, and my CD4 count is less than 200. All right. Then when we talk about testing. Okay, so obviously there's a bunch of different types of tests that you could do anymore out there for HIV. So most of them are pretty accurate, but no tests can detect the virus immediately after infection. So you have to keep that in mind. So as soon as a test can detect infection depends on a couple of different factors. So the type of test that's used, and then how quickly you go get it done. So there's a couple different kinds that they talk about here on the slide. So there's like an antigen antibody test. There is a NAT, which looks for the actual virus in the blood. And then there's just plain antibody tests. So it kind of just depends on, which way you go with this testing. So the big things that I want you to know about the testing is that, like, say you were working in a hospital somewhere right now and they wanted to test someone for HIV. Typically, you're going to see it either written as an enzyme immunoassay, which is EIA, or an ELISA test, which is ELISA. So enzyme-linked immunoabsorbent assay. So when a person's infected with HIV, they start producing these antibodies against the virus, usually within 3 to 12 weeks after infection. So when one of these two tests is positive, the EIA or the ELISA is positive, then that's like your first step. So you're like, okay, I'm getting a positive test here. Is this really right? So then they run a second test. And that second test they do is called a Western blot assay. And that Western blot is going to confirm that, yes, this is truly HIV. And the Western blot looks specifically at the antibodies. I think it looks at like a certain type of protein or something. So once you know someone has HIV, you have to think about other testing that you do as well. So if you're the healthcare provider for this person who has it, they're going to come in every so often for, follow-ups with you. And you're going to be drawing blood from them to see where they're at with their HIV. So one of the things that you're going to monitor is viral load. So the viral load is going to measure your plasma RNA levels. And these tests are used to track viral HIV disease progression and also CD4 counts. So as you are treating this person with medicines and stuff, you want to see that their viral load is really low, because as low as you can get it, because if that's super low like that, then that means they're going to be pretty healthy. Like they're going to feel really good like you and I. It's when your viral load goes up is when you're starting to feel really sick and bad. Also, the lower the viral load is, the longer the time to, progressing to that AIDS diagnosis. And so you have more of a survival rate. All right, so obviously our goals for treatment would be a few different things, right? So we want to make sure that we have decreased morbidity and mortality with this. We want to have an increased survival rate. We want to also restore and preserve immunologic function. So that means whatever little bit of CD4 count we have, we want to preserve that. We don't want it to get worse. So by giving them these medicines, that kind of helps do that. And then the third thing is we want to maximally and durably suppress their plasma HIV viral load. So again, we want this viral load to be down pretty low. And then the fourth thing is we want to prevent HIV transmission. So by keeping that viral load really low, even if this person, did do some kind of risky behavior, the chances of them transmitting it are really low, just because that viral load is super low. Now, I don't know if you've ever thought about this, but when someone gets HIV, you may be like, okay, well, when is treatment recommended? When would you start taking the medicines? So typically it's recommended when your CD4 counts are between 350 and 500. So they want you to, kind of get on it right off the bat. So the problem with these medicines is that they have a lot of side effects. So scientists are kind of really smart with this, though, because when you think about what happens with like viral infections in general, they're very hard to come up with a cure because they're constantly mutating, right? So what this therapy does, this ART therapy, it targets different stages of the HIV life cycle. So like, I don't know if you guys have read it. Hopefully you've read some of that stuff already about that. But anyway, to achieve viral suppression, patients must take more than one antiretroviral med. So they have to come up with combination meds that combine more than one of them at a time. I remember years ago, I used to take care of HIV patients in the hospital, and they would come in and they would have 3 million different pills they were taking, because at that point they didn't combine meds into one. And so you had separate ones for everything you did. And some of them were huge. I felt bad for them. So now, because we've come such a long way, now they combine them. So some of them will have like 2 meds in one or 3 meds in one. So it's a lot better for the patient. So the majority of patients that take ART have sustained reduction in HIV replication as measured by their viral load, and rise in CD4 and T cell counts, and also significant reduction in morbidity and mortality. So it's good to take them even though you have a lot of side effects. So there's a bunch of different categories of these antiretroviral meds. So there is the nucleotide reverse transcriptase inhibitors, so NRTIs. That's one category. And they may, just attack a certain part of that HIV life cycle. And then there's NNRTIs, non-nucleoside reverse transcriptase inhibitors, which they may, target a different part of the life cycle. There's protease inhibitors, fusion entry inhibitors, integrase inhibitors, and CCR5 antagonists. So each one of these categories, again, targets a different portion of that life cycle. So that's why, like, when you see people taking multiple things, that's why they're doing that, because it's, affecting, how well they are at the time by targeting these different areas. So when you're looking at, like what people might be put on, typically they're put on a protease inhibitor and then maybe 2 other things. So maybe 2 NRTIs or 1 NNRTI and then, a NRTI. So it just kind of depends on what they have going on. All right, and then you can understand why, when you look at some of these side effects, it's not going to be real pleasant sometimes to take some of these things. Also, there's more adverse reactions to some of these meds than I have listed here. So like more severe things like hepatotoxicity, nephrotoxicity. increased risk for cardiovascular disease and MI, insulin resistance. So there's some other more significant things that also can happen as a result of taking these. So what do you think would be a reason why, other than these side effects, can you think of any other reasons why people might not want to take their meds? Someone wants to say anything? So one of the things would be price, you know? So years ago when I was dealing with this, it was expensive as all get out to have any of these HIV drugs. A lot of people couldn't afford them. So that was a big thing to why people weren't taking them. Another thing, which I don't know if you thought about, but there's a big stigma to having HIV. And it's probably not as bad as it used to be, but it's still there. And so when other people find out that you have it, maybe you have lack of social support. So that could be part of your problem. Also, depression. A lot of people go into a big depression after they find out they have this. So, you know, when you're depressed, do you really want to do anything? No, right? So that could be part of your issue. Sometimes people react in bad ways and they start to, you know, abuse different substances like smoking and alcohol and stuff like that. So that could be an issue as well. So the problem is when you stop taking this medicine, you can develop drug resistance. And so just like when we talk about antibiotics and things, and we always say, hey, you need to, you know, stay on your antibiotics for the amount of time that they tell you to. Well, the reason for that is if you get off of it quicker, then you're going to end up developing drug resistance, and then you're going to start getting symptoms again. And then when you go in to get, you know, treated, whatever they normally would treat you with isn't going to work as well. So now they have to find something else to give you. So same thing here. So we need to make sure that we address issues that may be preventing people from taking their meds. All right, so I jumped ahead a little bit. I talked about that. Okay, so then another thing I have here is growing older with HIV. So, you know, since this is kind of like a young disease in a way, we didn't know what it would be like to have older adults with HIV because we just didn't have that at the time. So now, because we have such good, you know, drug therapy and everything, we're having a lot of older people who have this now. So people aged 55 and older. So according to the CDC, they account for 26% of all Americans living with HIV. So that's kind of a big percentage. So now we're starting to see people who have multiple comorbid conditions in addition to this. And so their treatment gets a little bit more tricky. Other reasons why we're seeing more older people with this would be, you know, like I said, now they have better protocols for, you know, treating blood products and doing, you know, transplants and things. So you don't get HIV that way anymore. But some of these people who have it currently that are older may have got it that way. And so that could be a reason. And then also, I think we've talked about this in other classes in the past. We said older adults don't necessarily, you know, use protection very much when they have sex because they think, okay, I'm older, I don't have to worry about getting anyone pregnant, so whatever, I don't need to use this. But they don't think about like the sexually transmitted infections or HIV or anything that they could get. So that's another issue. So with older adults, we really need to make sure we talk to them about some of that stuff. It's still important because they just have a different viewpoint of it, you know, just from their generation. Okay, also on this slide, it talks about you know, as your HIV progresses and you get older, you may start to see some other different things happening. There's something called HIV, I think it's HIV dementia. They call it a few different things. But basically, with this, you can get problems with your attention, your language, your motor skills, your memory, and some other cognitive functions that you have. So it can really affect your quality of life over time. All right, so then this gets into AIDS a little bit. So obviously, you know, we said to be considered to have AIDS, you have to have HIV first, and then it progresses to this once your CD4 count gets below 200 and you get an opportunistic infection. Then you have full-blown AIDS. All right, so again, this is like the most severe case of HIV infection. So HIV is AIDS, but AIDS is not necessarily HIV, if that makes sense. All right, so as far as prognosis goes, when you get to this point, if you don't do treatment, usually you're going to survive maybe about 3 years or so. Now, that's probably better than it was years ago. Years ago, you probably wouldn't survive that long even. Once you have a dangerous opportunistic illness, your life expectancy without treatment is going to fall to about 1 year. So the drug therapy actually really helps you. So even if you were in full-blown AIDS and you just recently started it, it would help you. So this can be helpful to people who have AIDS when they're diagnosed and can be life-saving. Your treatment is likely to benefit people with HIV no matter when it started, but people who start it soon after they get HIV experience more benefits. So obviously, if I had HIV newly diagnosed and I started my drug therapy, that person probably would live way longer than this person who already has full-blown AIDS and starts it. Now, when I'm in this stage of my illness, my symptoms are going to change. They're going to get worse. So remember, some of those things we looked at earlier were more like flu-like symptoms. So now you're going to start to see weight loss. You're going to start to see chronic diarrhea, night sweats, persistent cough, mouth and skin problems, regular infections, serious illnesses, or other diseases that go along with this. So now it starts to get a lot worse. So there is in my other med-surg book that I have, there's a thing that they talk about called HIV wasting syndrome. So this is when people start losing a ton of weight and they just can't keep any weight on them. So sometimes when people get to this point, they almost look like they've been in a concentration camp because they're so, like, your body uses all of the muscle that you had and any fat that you had. So like there's nothing left to you. You just look like skin and bones. So when people get to this point where they just can't keep putting on the weight, sometimes they'll bring them into the hospital and they'll put them on TPN for a little while. So TPN is total parenteral nutrition, and it's just a way to give them nutrition for a short period of time to kind of get them boosted up until you can come up with another thing to do for them. A lot of times they are at this point because they have a hard time taking food in because their mouth and everything has a bunch of sores and stuff in it. So you always want to think, okay, what can I do to make this person feel better? So maybe, you know, do some kind of rinse for their mouth several times a day with saline or sodium bicarb or something. That helps to reduce that mouth pain, and it might help them increase their appetite. If their mouth isn't hurting so much, maybe they can actually get something in. So this type of person, you would want to serve 6 small meals a day and also increase what they take in protein, because that's going to help them a little bit more. All right, and then this last slide talks about these different opportunistic infections. I'm not sure how much realize it goes into with this, so I just want to tell you a little bit about some of these because maybe you just don't know what they are. So anyway, these opportunistic infections that we're always worried that people are going to get, that's going to, you know, make them get worse. There's specific ones that are kind of more popular. So I'm just going to tell you a little bit about each one of those. I don't know, have you guys heard of pneumocystis pneumonia before? This is a type of pneumonia that's specific to someone with HIV. So with this person is going to get it. They're going to have shortness of breath with it, fever, non-productive cough, chest discomfort, like anyone would with pneumonia, right? But then the thing is with this, they also will sometimes get oral thrush in addition to having this at the same time. So your fever is your predominant symptom. And then the way to diagnose that that's what's going on is a bronch. So typically they'll send them for a bronchoscopy, and they actually are able to get sputum samples or tissue samples or whatever they need in this bronch. So you could, you know, test their sputum for this, and that's how you'll know for sure that they have this type of pneumonia. Another one that I don't know if you've heard of before, it's Mycobacterium avium complex. So this is going to probably occur in people who are like really sick at this point. So typically people who have a CD4 count of less than 50. So it's caused by 3 different mycobacteria symptoms. So usually they'll have fever, night sweats, weight loss, fatigue, abdominal pain, all of that. So you would diagnose this through blood cultures or doing a bone marrow, you know, where you could sample some of their body fluid. So that's probably pretty bad. So someone at that point, if they have 50 cells or less for their CD4 count, that's horrible. So that's probably going to do them in if that's the case. And then TB. So TB, I know we talk about that, you know, with our respiratory chapters and stuff, but people don't necessarily think about this with HIV very much, but you kind of should. So I don't know if you guys have talked about this in previous classes before, or if you know much about it, but TB, when you get this, you know, of course you inhale it somehow, you know, like you get it through the air, it's airborne. But sometimes people can have TB and they don't even realize they have it. They have what you call a latent form of it. So when you have latent TB, this means that you've been exposed to it. It's actually in your lung. So it makes like this little thing called a Gone tubercle in your lung. And so once it gets in there, your body tries to do its best to fight it off. So sometimes your body will encase it in the lung so it looks kind of different. Like if you looked on an x-ray, it would look different. So this person who has latent TB does not have symptoms. So they're not contagious at that point. But this is the kicker. When you have HIV and your immune system is low, that's when this could kick in. So if I have this latent form of TB, now it turns to active once my immune system is low. So then I start getting symptoms, and now I'm contagious. So with this, you know, if you find incidentally that someone has latent TB, you always want to treat them for it right off the bat, because you don't want this to turn into an active form later on. So with TB, typically you're on antibiotics for a good, you know, 6 to 9 months to try and get rid of this. This can be fatal if treatment is delayed in people with advanced immunodeficiency. So it can be bad. And with TB, it doesn't necessarily just affect your lungs. It can affect other areas of your body as well. All right, I mentioned a little bit about HIV wasting syndrome, and I think you guys pretty much probably know what candidus is. That's a lot of, you know, things that someone with HIV would suffer from too. There's another thing called Kaposi sarcoma. This is a thing that's caused by human herpes virus 8. So it affects men more than women, and it can spread through sexual contact. It involves the epithelial layer of the blood and lymphatic vessels. And you get these like spots all over your skin. And so the cutaneous signs are brownish pink to deep purple. They could be flat or raised and surrounded by ecchymosis. The location and size of some of the lesions can lead to venous stasis. You could get lymphedema and pain from them as well. So there's a bunch of different sites that these things could pop up at. So you could see it inside the GI tract, in the lungs, in the lymph nodes. But if you get them in your internal organs like that, it can eventually lead to organ failure, hemorrhage, infection, and death. So the way to diagnose this would be to biopsy one of those tumors. Prognosis depends on the extent of the tumor and other symptoms of HIV infection, and also the CD4 count. So I don't know if you guys have ever watched like a movie that had someone with HIV in it that had this. There's an older one called Philadelphia that had Tom Hanks in it. And Tom Hanks had Kaposi sarcoma in this movie. And so in that movie, he's a lawyer, and he fights back because his company, they get rid of him once they find out he has HIV. So that's the whole, court scene. He's trying to fight back against that all the time, where he's getting really sick. So in the movie, when he's on the stand, they tell him, hey, did you have these lesions at such and such date or whatever? Do you have any now? Can you show the court? And so he opens up his shirt and you see all these different lesions all over the place. So this is like a really common thing that you see people with HIV have. It can be really devastating. And then there's a couple others. I won't read all of these to you, but you can kind of get the picture. There's quite a few different things that you can suffer from that could put you really at risk for death, once you get to this stage. Okay, so I also made a Kahoot for you guys, so we can kind of go through some. On the Kahoot, it's just 20 questions, and it has a little bit about HIV/AIDS, and it also has a couple of other things that you were going through in week 4 stuff for like immunity and all of that. So let me find that real quick. So again, just go to this kahoot.it and then you type in this number. Does no one else want to play?
Yeah, I'm trying to log on right now.
Okay.
Mine is still downloading. I'm more than like halfway there though.
What are you downloading?
The app.
You don't need to download the app.
Oh. So I can
Just-
just go.
Yeah, just
Go on.
put Kahoot.it in your search engine and it should bring it up what you need, and then just put in the number.
Okay.
There you go. All right. Is there anyone else who wants to play, or can I go ahead and start? Okay, I'm going to start then. Okay, what is active immunity? Okay, so active immunity requires direct exposure to an antigen. Good job. Okay, what's natural immunity? Okay, so this occurs when the mother passes antibodies to her unborn baby. Okay, an anaphylactic reaction is which type of hypersensitivity? There you go. It's a type 1 hypersensitivity reaction. Good job. Okay, angioedema is best described as. Okay, so this has to do with that swelling associated with allergic reactions. So, do you guys know of? There's like 2 categories of cardiac meds that have this as a possibility. Do you guys know which ones I'm talking about? No one remembers from Farm? So, ACE inhibitors, this is a possibility. It's a slight possibility, not like a huge one, but sometimes you'll see this with that. And then the other one is ARBs, ARB, ARBs, angiotensin receptor blockers. Those are the two cardiac groups that could have this. Okay, what does HIV attack? Good. Okay, how is it contracted? Okay, so remember this is just through infected fluids. So you can't really get it through the air or germs on your surfaces of anything. It's not like that with HIV. Okay, the Western blot is what? Okay, so remember this is the second test you would do to double check and make sure your positive result was right for HIV. So it's tests antibodies. Okay, effectiveness of antiretroviral therapy is determined by what criterion? Okay, so you know the medicine is working if their viral load is really low and their CD4 count like increases or gets, stays the same. Okay, what is ART or heart therapy? Okay, so this is just another name for antiretroviral medications. It's a combination of them. Okay, the first symptoms of an HIV infection are so this is those flu-like symptoms. That's why it makes it so scary because people generally don't realize they have this and they still spread it to other people. Okay, one way that HIV can be transmitted is yeah, So through breast milk, always through body fluids. Okay, at what CD4 count should an HIV positive patient be placed on medicine? Okay, geez, that one was quick. Yeah, so if your CD4 count is about 200 or so, usually that's when they would put you on this. So you wouldn't wait till they were this low. During which stage of HIV is one most susceptible to opportunistic infections? Oh, we had a hard time with this one. All right, so you're more susceptible to opportunistic infections when you're in late stage HIV because that would be your AIDS, when everything gets worse. So at that point, your CD4 count's super low, so that's why you're going to get infected with more things quickly. Okay, what is an opportunistic infection? Yeah, so it's just normally it would be non-lethal to you or I, but it becomes lethal when someone has HIV. Okay, which type of infection can be caused by septicemia? Okay, so septicemia is going to be a systemic infection. So this means that it goes to all parts of your body. It makes you super sick. Whereas a localized infection would be more, at a certain site, right? Okay, what's antibiotic resistance? So whatever bacteria you have resists the effects of the antibiotics because you quit taking it, before you were supposed to. Okay, below 4 ways that healthcare associated infections can be spread. Choose the one that's most common. Yeah, it's usually from our hands because people don't wash their hands good enough. That's the most common one. Doesn't mean that some of these other ones aren't right because they probably are, but this is the most common one. Okay, the most commonly reported healthcare associated infection is UTIs, believe it or not. So that's usually like probably the biggest problem in all hospital and healthcare facilities is UTIs. Okay, hospital-acquired infections are also known as? These are called nosocomial infections. That's the other name for them. All right, you guys, I think this is the last question here. Treatment for allergic reaction is what? There you go. Yeah, we're going to give epinephrine, the EpiPen. Okay, guys. All right, so hopefully that helped you a teeny bit with some of the material that we had this week. So this is my plan. I'm going to go to my appointment here shortly. And then as soon as I get back, I'll get back online and I'll send you guys an email to let you know I'm back and we can go ahead and get started as soon as I get back. Okay? With our lab stuff. I think our lab stuff we just have, I think it's, I want to say Unit 8 or something, has to do with IV stuff again. So if you don't have that done yet, make sure you go work on that here shortly to get that done so that's completed. Any questions about anything in particular before I get off here?
Do you know like about what time we're gonna be back on here?
I don't know because my appointment's at 12:30. So like I said, I'm shooting for like maybe 2 or something, but I don't know for sure because I don't know how long they're going to take with me. Hopefully I can get out of there quick and come back
Okay.
sooner.
Okay, just because I might not be home at that time because I'm supposed to go and take my grandma to an appointment as well. So I just didn't know.
Yeah, if you're not here, you're not here. But do me a favor, if for some reason you aren't, you need to make sure you listen to the recording because
Okay.
it's part of your lab time, you know.
Right.
So you got to be doing that stuff. Okay. Any other questions? Okay. All right. I'll see you guys later.
Thank you.
Thanks.
Bye.